Good evening. It is Monday, April 6th. This is Tim Ashe. I'm president of the Vermont Senate, here with my daily update on Vermont's response to the COVID-19 pandemic. I hope you've been able to watch the last three, so Friday, Saturday, and Sunday. Each of my updates was an opportunity to pass along thanks and appreciation to different people and organizations and businesses in Vermont who have been stepping up and really helping their neighbors, helping community members keep people safe, going above and beyond. And it really felt good to do them. I feel like as people are under such stress and so much uncertainty and their economic lives getting uprooted, the public health scare, it's really critical that we express ourselves and support those who are putting themselves in greater risk as a result of their work or their activities. So if you didn't see them live, I hope you'll go back. They're on my Facebook page or a YouTube channel. Things are getting really technologically serious around here. Today I'm going to return to my more conventional updates where I try to provide some useful information on what's transpired in the last 24 hours. And I'm going to have a brief sort of special focus on the issue of people who are self-employed and independent contractors who have been waiting anxiously for the federal government to follow through on the $2 trillion relief package and actually clarify how and when people are going to be able to get the benefits since they're going without any income right now. I want to start with a few bigger picture updates on just a status report. First off, we now have 543 positive tests since this outbreak began. Of course, that doesn't include those who have had COVID-19 but never got tested at all because their symptoms weren't very severe. And it probably also doesn't count people who contracted this virus before any testing was going on and before we really appreciated its severity and how much it was spreading. 23 people have now passed away, and while we are preparing to try to do everything we can to keep the number of people being infected down as low as we can, we're preparing for the worst, hoping that we can keep the numbers as low as possible. I hope that made sense. There are currently 28 people who are hospitalized with COVID-19 who have tested positive and their symptoms are so severe that they have been hospitalized. And another 63 are hospitalized who don't yet have a test result, but who have been admitted because their symptoms are very severe, and we suspect that they are positive with COVID-19. One thing that happened over the weekend, and this has confused some people because it seems that the federal government and the Department of Health have gone back and forth on this, is the State Department of Health and our governor are now recommending that everybody who finds themselves leaving home to take care of some essential needs like going to the grocery store or the pharmacy, even going for a walk, anywhere where you're not going to really be able to be easily socially distanced, should be wearing a cloth mask. The cloth mask is not a savior and protector with 100% infallibility. What it will do is likely prevent people who have become infected but don't know it and are not yet showing symptoms from being as likely to pass it on to others. This is the mask that I just had a friend make for me. She was very gracious to make it and drop it off. And when the Senate returns to the State House on Wednesday, we're going to have a skeleton crew to pass a resolution allowing us to have remote voting so we don't have to keep putting ourselves in close proximity. It will feel very unusual, but I will be wearing this or another mask along with my suit when I show up in Montpelier, as will the rest of the members of the Senate. We expect to be there, incidentally, very briefly, just long enough so that we can authorize ourselves to vote remotely in the future and then get the heck out of there and return to more safe environments. Second thing I want to mention, Blue Cross Blue Shield, primary commercial insurer in the state, announced today that they will be waiving all cost sharing for inpatient COVID-19 treatment. So previously, all of the insurers effectively said that testing will be waived and various emergency room services and other things would be waived. Now, all in patient treatment, which is often very, very expensive, will also be waived. So that's a bit overdue, but good news nonetheless. And then the third thing before I turn to unemployment insurance is that the governor indicated during his press conference today at 11 that it is likely he will be extending the stay-at-home order and the declaration of emergency, which currently are in effect till April 15th. And I think the expectation is that that will be extended some number of weeks later. We hope, obviously, that the news will be getting better during those weeks and that things can be safely transitioned on the way back to normal. But I think it is important that the governor signal to people that while we will continue to do everything we can to keep the number of infections down, we have to be very vigilant and shouldn't expect that someday there's going to be a light switch that goes on and then we're all back to normal. It is going to be a slow process of getting ourselves back on our feet after this. And I think it's good the governor's preparing people for that news if and when it comes in the coming couple days. So now I'd like to turn to the issue of unemployment insurance. And I have never in my 12 years in the Senate received a higher volume of communication from people on a single topic than I have in the last 3 weeks about who is and who is not eligible for unemployment insurance. This is most of these calls and emails have not been coming from people who are employed in more conventional settings where you get a W-2 and you've got an employer who pays you on an annual basis, salary or hourly pay. These calls and emails are coming from people who are self-employed or independent contractors because they are normally not allowed or eligible for our unemployment insurance system, but the federal government has created a new program that is effectively it's a copycat of unemployment insurance, and people who are self-employed and independent contractors will be eligible. The frustrating thing is that we're about a week and a half into the new world order after the federal government passed its $2 trillion relief package. And what we have found is that it was easy for them to pass a $2 trillion piece of legislation in about 2 days, but it has now taken a week and a half and we still don't have the actual guidance and go ahead to flip the on switch and allow people to start receiving the benefits. So for all of you who are very frustrated and sometimes frustrated when you contact the Vermont Department of Labor, what you need to know is that the Vermont Department of Labor wants to be able to get these dollars out the door, wants to be able to tell you precisely how much you're eligible for, but until the federal government gets us these details, we are in a bind where we know how desperately you need the money, but we can't yet get it out the door to you because we don't have the federal permission. However, I do want to talk about a few things that are somewhat encouraging, I hope. The first is that while you cannot go all the way through the unemployment application system, since you are not yet eligible as a self-employed person or independent contractor, what you can do is fill out an initial claims form. And when I'm done with this video, I will put a link to that form if you haven't already filled it out on the comments section of this video. And once you have done that, you will have effectively gotten a big jump start. And the moment the feds give the Vermont Department of Labor the go-ahead, you will already be in the system. They will then be able to contact you and get things moving in a hurry. So I really encourage people to, the soonest you can, fill out the online initial claim form is what it's called. I'll have that link available and you'll already be in the hopper for when the system goes live. An important thing to know for your financial planning, because many of you are worried that with each day that passes, you're passing up the benefits which the federal legislation entitles you to. I hesitate to say good news since we've got this delay, but the fact is You will be eligible starting retroactive to the week beginning March 29th. So it will go back to effectively last Monday, and that's when the start date is. The legislation passed just 2 days earlier or 3 days earlier on a Friday. It was signed very late at night by President Trump 2 Fridays ago. So basically, last week and this week will be the first 2 weeks of benefits to which you will be entitled, and you will receive, even if it took 2 more weeks for you to fill out the form and get the final check from the Department of Labor. So the sooner you get in, the more comfort you'll have that that the Department of Labor knows who you are, where you are, and what your circumstances are. You can get through some of the bugs of filling out the form, because most of you have not filled out an unemployment form before in your lives. So get through the bumps, and you'll probably have some questions, and it'll allow you to get answered, and then you'll be able to submit the initial form, and the benefits will be retroactive to March 29th. The other piece is, while you cannot yet really know what your weekly benefit will be, the one that's calculated based on your income, what you will know is that you are going to get $600 a week on top of whatever else you're eligible for. So, from a financial planning point of view, you should operate under the assumption, if you're self-employed or an independent contractor, that you are going to get $600 plus for last week, $600 plus for this week, and every week moving forward. That applies for self-employed and independent contractors, and also some people who have worked a little bit but not enough to qualify under normal unemployment rules. So many people, despite the frustrating wait, will receive some desperately needed cash to help you pay your bills. Feel free to ask me questions offline if that isn't clear enough to you, and I will make sure I do whatever I can to help. The other thing, I've had some questions from people who were on unemployment insurance already because they had lost their job for some reason prior to COVID-19, and they were about to run out of their eligibility, their number of weeks, and they ask if they're still eligible to collect any benefit. The short answer is yes. Obviously, right now is not an easy time to be on the job search. And so the federal legislation has extended the length of time someone can collect unemployment to, I believe, 39 weeks, so an additional quarter of the calendar year. This is similar to what happened during the stimulus bill, when people who wanted to work just couldn't find jobs. So if you're running out of weeks, while we still hope you will be able to find work relatively soon, your benefit will not be cut off. It'll be extended for another 13 weeks. That all the people who are already in the unemployment system, so including people who've been laid off as a result of this crisis, the $600 additional check that I described earlier in the context of self-employed and independent contractors is also going to be sent to people who are collecting unemployment insurance. That $600 check will also be retroactive to March 29th. So March 29th, that week, which ended this past Friday or Saturday, you'll get $600 for that week. You'll get $600 for this week, $600 on top of your normal benefit for each week moving forward. So hopefully that helps you think about what your financial situation is. And the good news for those who are already in the system is you do not need to do anything extra to get that $600 check. It will just show up in one of your benefit checks moving forward, including the retroactive one. So I have felt the stress and anxiety of literally hundreds and hundreds of people as they've called me and emailed me in the last just couple weeks. And I want to let you know that Vermont state government, and it's both the Scott administration and the legislature, we totally understand what you're going through, and we'll react instantaneously when we find out the moment that you're able to start getting the cash submitted to you. That said, we are still trying to encourage the administration, the Scott administration, to boost the resources at the Department of Labor so that they can handle all these calls and emails that are coming in and the online form. because it's so frustrating when people fill out a form and it crashes halfway. So we're still on them. I think they're doing the best that they know how to do, and hopefully we can bring some additional expertise on to get them even more successful to get it through. The other frustrating thing is for the people who are still working, many of whom are doing things that put them at great risk. Some have contacted me and said, wait a sec, other people get $600 on top of their unemployment benefit, but I'm not getting $600 and I'm actually going to work. How is that fair? And I don't have a great response other than to say the federal government did what it did. We were not the ones who wrote the law. We're the ones who are on the receiving end. And what we are trying to do is find a way through the state legislature, and we'll work with the governor's team, to provide some kind of hazard or pandemic pay bump so that those who continue to show up for work and put themselves at risk will not be the only ones who don't seem to be getting some kind of extra federal relief. So in the days ahead, I hope to have more to report to you on that. I've assigned 4 members of the Senate from both political parties to come together and really try to work with our fiscal team to see what the options are. So I'm very hopeful we'll be able to pull something off. I don't have anything to report just yet, but hang in there for those of you who are doing everything you can. I want to talk a little bit briefly now about, I got 3 more things before I wrap. The first, I want to put in perspective the latest financial information for the current state budget year. So on previous updates, I've probably bored some of you to tears. I hope you weren't listening while you were driving, about how our state budget year goes from July 1st to June 30th. So we're about 3/4 of the way through the state budget. And because of the suddenness of this crisis from an economic point of view, we are not in good financial shape right now. And to put it in perspective, I'm going to just rattle off a few numbers. These are hopefully illustrate for you the challenge that we have in the legislature working with the governor's team to figure out the finances as we move along here. The first thing is for the 4th quarter of the state fiscal year, the one we're about to be in, we expect income tax collections to be down $200 million from what we had expected. So $200 million in the grand scheme of the federal budget would be like dust in the wind. In Vermont, $200 million is a massive amount of money. So that's a challenge we're going to have to figure out. Rooms and meals tax, the tax that people pay when they rent a night's room at a hotel or a B&B, and the meals tax every time you buy a prepared meal at a restaurant, down $30 million for the next 3-month period. Our state's education fund, which receives both property tax payments and sales and use and a variety of other taxes to pay for our school system, is down $142 million for the next 3 months. And our transportation fund, which pays for basically everything that falls under the self-obvious category of transportation, but includes public transit, rail, road projects, bridges, and so on, down $43 million. And that one I'll just briefly explain what the contributing factors are. The gas tax is collecting about $12 million less than was previously anticipated. Obviously, people aren't driving to work in the way they were. $12 million less in purchase and use tax, which is effectively the sales tax you pay when you buy a car. So people are obviously not out there, and the auto dealerships have been required to close for sales. So $12 million reduction in purchase and use tax, and $16 million reduced motor vehicle fees. There are a whole range of fees paid for by people like me and you, people who drive commercial trucks, and that is down $16 million. So I tell you all these numbers not to scare you or be alarmist, but to say that the challenges from a fiscal point of view, once we get through the public health crisis, are not going to be insignificant. And much of the money we get from the federal government will not be allowed to be used for just whatever we want. And it's not going to be, we think, allowed to just backfill our revenues that are down. So If there is one silver lining, and I don't even know how I can say this out loud. There is no silver lining, but let me just say that the Great Recession, which was about 10 years ago, state government in Vermont has some not distant experience trying to work our way through some very savage economic times. So hopefully some of the lessons we learned then will apply now. And in terms of some of the crisis response and all the surge hospital facilities and all those things that we're doing to quickly get out and keep people from being infected, take care of people with acute symptoms. It is not unlike our immediate response after Tropical Storm Irene. So in that sense, we also have some experience helping people, local communities and hospitals and others, figure out how to draw down the most federal emergency management money. So hopefully our experience in recent years will help us, but I guess history will judge. Two other things. First off, Birchwood Terrace. I've mentioned that Birchwood Terrace on North Avenue in Burlington has had a really difficult outbreak. And now, in addition to the 26 residents who have tested positive for COVID-19, 22 of their employees have tested positive. They're testing everybody. So that is a very high number. And obviously, nursing home facilities and recovery care facilities are very staff dependent. So 22 people down is a real problem. I want to commend UVM Medical Center for having some of their staff fill the gaps at Birchwood Terrace, which is a sign of how our healthcare professionals are all banding together and really responding wherever the need is, and putting aside, the affiliation on the badge that they wear, and really just going wherever they can be the most useful. So thank you to the UVM Medical Center crew for stepping up, and obviously we're sending our best thoughts to Birchwood Terrace and all the staff and patients there and their families to make sure that as many people can get through this healthy as possible. And last, yesterday, my third day of thanks and appreciation. It was a weekend of expressing gratitude. One senator got his recommended person to be recognized to me just a little bit late after I had finished wrapping up the video. And so Bobby Starr, who lives in North Troy in the Northeast Kingdom and represents Orleans and Essex in the state Senate, wanted me to mention that Catherine Sims, who lives in Craftsbury and runs the Northeast Kingdom Collaborative, the NEK Collaborative, has been doing just an amazing job coordinating the community response, developing a resource list for all the people in the Kingdom towns, hosting weekly check-in calls with all the organizations and groups that provide services so that it's as efficient as possible getting people what they need. So want to acknowledge Catherine on behalf of Senator Starr and the Northeast Kingdom Collaborative crew who are doing such great work. So with that, I'm going to wrap. I want to thank you for listening in. Do want to ask you, if you have the time, go back and listen to the last three videos. I think you'll find they were all submitted to me by others, by either constituents, people around the state, or members of the Senate on my video yesterday. And I find it, I've listened to them, I've gone back just so I can hear the names of people in the organizations who have been putting their best selves forward to meet this crisis head on. And I think it really speaks to the resilience of our state and how people really do lend a hand to one another in the greatest sense of Vermont's tradition and values. So I'm going to sign off for now. Tomorrow I'll give more updates on what's going on with the state. Hopefully I'll have some more information from the Department of Labor and the Agency of Commerce about tools to get people the resources they need. And in the meantime, I've got to remind you, the cloth masks are being, the directive is to wear cloth masks when you're in public doing essential grocery shopping and things like that. And it's not the most customary thing for people in our country to do. And sometimes it might feel awkward, but each time you put that on, you could literally prevent someone from getting sick and ultimately dying. And I think if you put it in that perspective, each time you throw it on, you'll probably be, like me, a little less vain when you throw on something and worry if you look a little unusual. So get past that, keep people safe, and I'll check in with you tomorrow.